in the Disability Services Division and will be presenting today. Thank you for joining us. I'd like to dive right in. The webinar is scheduled for 1 hour, and we do want to have time for responding to participant questions and comments as much as we can during this time. Again, I extend a welcome and a thank you for everyone who's participating and joining us for this webinar today. We appreciate your partnership. We welcome your feedback, and we are especially grateful for your collaboration as we all work together. The Disability Services Division's Fiscal Policy Team is hosting this webinar with the support and participation of other policy areas and areas within DHS to share some general information about the change to the rate methodology for family residential and life sharing services. The fiscal team is committed to supporting, and I say on this slide, or we say on this slide, DSD fiscal, but what we really mean is DHS is committed to supporting our county and tribal nation and service provider partners as we implement this and other rate changes in 2026. Oops. So just the content we'll be talking about today in this webinar is family residential or FRS and life sharing rate changes, the why, a little bit of background on the change that the legislature has made, the how, so what the new rate structure will look like, and the what, so what are future updates to these rates, what are next steps in implementing this rate change. The webinar is being recorded. Recording is turned on, and the recorded webinar as well as the presentation itself will be posted in the DSD Training and News Archive. We ask that participants submit any questions or comments using the Q&A function in your WebEx presentation. Please keep the questions and comments that you submit general, meaning please do not include private information or refer to specific cases where the individual could be identifiable. Please also be patient with us. We, as I mentioned, we have several colleagues from Disability Services and other parts of DHS monitoring the Q&A, and we will do our best to respond to questions in the Q&A during this webinar. So please feel free to post questions throughout, and those subject matter experts will do their best to respond with whatever guidance and information that we have. And we also anticipate having time after the slides are finished for response to questions and comments as much as we are able to allowed. Case-specific questions should be submitted to DSD via the DSD contact form. So a little bit of the background. The legislation noted here, this is a hyperlink, so later on if you wish to go get the presentation from the training archive, you will have this hyperlink. But the language on this slide is the language from legislation regarding changing the rate methodology for determining rates for family residential and life sharing services. So the first piece, subdivision 19 of State Statute Section 256B.4914 reads, the Commissioner shall establish rates for family residential services and life-sharing services based on a person's assessed need, as described in the federally approved waiver plans. Rates for life-sharing services must be 10% higher than the corresponding family residential services rate. And then a note, so kind of at the bottom of that piece of legislation, there are a bunch of notes that are add-ins to different sections. Subdivision 19, as added by laws 2023, Chapter 61, Article 1, Section 47, is effective January 1, 2026, or upon federal approval, whichever is later. The Commissioner of Human Services shall notify the reviser of statutes when federal approval is obtained. So those are the laws passed by our legislature governing what is happening, the change to the rate methodology for family residential and life sharing. Just a little bit of additional background on this piece of legislation. It was added by laws of 2023, Chapter 61, Article 1, Section 47. It requires the commissioner to establish rates for FRS and life sharing based on an individual's assessed need, and was amended by 2025 session law to increase the previously established rates, meaning the rates established as a result of that 2023 law, to increase them by 25.84%. So what informed the new rate structure is a study that DHS commissioned on the order of the legislature to make recommendations for a new rate methodology for family foster care or family residential services. And key findings from that study, and these bulleted points on this slide were pulled directly from the study, which is hyperlinked here. Most state waiver programs use either a flat or a tiered rate structure for family foster care rather than cost-based. Current family foster care rates, and what this refers to is the rates at the time this study was being done, which was, I believe, 2018 and 2019. The rates varied widely, which is understandable. Framework rates, the study found, were higher on average than banded rates, meaning historic rates that were in place prior to the implementation of the DWRS, or Disability Waiver Rate System. But there was considerable variability found in both historic rates and in framework rates. But those banded historic rates showed a stronger relationship, according to what was found in this study, with people's support needs than framework rates. So how we got here. The Minnesota legislature required DHS to move FRS and life sharing from a rate to the rate tiers, and that rate tier structure is the findings of that study, the recommendations from that study. These rate tiers align with support ranges as indicated by case mix. So each individual who receives a Min Choices assessment has a case mix that is generated as part of that assessment, or once the assessment is complete. And those case mixes are grouped into tiers, and those tiers represent the rate, or tiers are the rate. The legislature requires DHS to implement the rate structure recommended in the 2020 study effective 1/1/26 or upon CMS approval. And then the 2025 legislature passed an increase of 25.84% to those rates. So key features of the new rate structure: it is based on the individual's assessed needs as indicated by the case mix that is generated once the assessment is complete. They are subject to inflationary adjustments. So any inflationary adjustments that the legislature approves, authorizes, requires, would be applied to these rates. They are ineligible or not eligible for DWRS rate exceptions, which are able to be applied to framework rates. This will no longer be a framework rate. So some questions that we've already received that we wanted to share today. Do FRS providers still have to submit the 6790 form? That's the form, with the proposed shared and individual staffing and other elements. That's no. The rates are determined based on the assessment, so there will be no more requirement to use or submit that form in order to have a rate or a service agreement, do providers still have to submit cost reports? No. Cost reports are a requirement of providers who file claims for DWRS framework services. And because these will no longer be framework services, they will no longer be subject to cost reporting requirements. Can FRS providers request a rate exception? As stated in legislation and on the previous slide, the tiered FRS and life sharing rates are not eligible for rate exceptions, and that's because the rate is tied to the person's assessment and assessed need. So what should a FRS provider do if they feel that a person's rate isn't adequate to meet the person's needs? It's actually kind of similar to what would be done currently, which is to work with the person's case manager. It just wouldn't be to work with them to submit a rate exception request to DHS. It would be to determine if maybe there's another allowable service that could be added to the person's support plan that might be helpful to meet the person's needs, or if the person's needs are such that they may need to seek a different residential service. Those are just some ideas. Certainly, other options could be considered just depending on what they are and what the person's needs are. Some more questions that we've already received is, when will they take effect? And again, an earlier slide mentioned federal approval, implemented 1/1/26 or upon approval. I apologize because I don't know, but I suspect there might be a SME who is monitoring the Q&A who can confirm for us if we are on track for 1/1/26 or what. And as with other rate changes that we've had in the past and have going forward, the tiered rate will be authorized at the person's waiver renewal, starting on the date that we either 1/1/26 or the date we have approval from CMS. What that means is that at, for a service agreement starting on or after 1/1/26, the rate produced in the support plan application will be the tiered rate. So I am just getting a little ping from our subject matter expert in the waiver plan area saying that the waiver plan amendments, the amendment package that would include this particular piece of legislation is not yet out for public comment. We do not anticipate that we will have CMS approval by 1/1/26. So what that means is that for renewals that occur or new service agreements that are in place effective 1/1/26 through the date we receive CMS approval, the rate would still be calculated using the 2025 framework. And for renewals that occur after the day after we receive CMS approval, those would be determined using the tiered rate. So that kind of speaks to that second bullet. What if approval isn't received until after January 1st? We delay implementation until the day following receipt of CMS approval. So the Disability Services Division's contact form is really the best way to reach DSD. It's a secure form and it has generous narrative section to put in narrative. If it's a specific question about a specific case, county, participant, recipient, the person's PMI could be put into that form because it is secure. And the forms are routed to the policy area that can best respond to the question. If the question or comment or concern, the guidance needed covers multiple policy areas, we are able to work on that across the entire division and respond to the person submitting the question that way. So it's really a great way to reach DSD. without having to know a specific person's name. Um, you can get to that person. Um, we've reached the end of our formal slides, which leaves us a significant amount of time to respond to questions if you have them. So I will be leaning on my colleagues who are monitoring the Q&A to funnel questions and comments to me to read aloud during the remainder of this webinar. And we'll do our best to answer questions and respond to concerns. And please note that we welcome and actually seek input, comments, and questions. That really helps us to know what things we need to make sure are published in guidance and provided in other ways. So that's we welcome your participation. I see there was a question about the PowerPoint. So on the DSD training archive page, both the recording of the webinars and any handout that was included with it, which is usually just the presentation itself. So a PDF of the PowerPoint slides are also published there. So the PDF of these PowerPoint slides will be published to the DSD training archive along with this recording. So the presentation itself. And my quiet here is just waiting for questions to pop up in the Q&A. So one question that we see is, why were FRS providers left out of any input for this new rate system? So again, in previous legislation, and I apologize for not knowing exactly what year DHS was required to research a new rate methodology for family foster care or family residential services, as it's called. But I believe it was 2018. I could be wrong about that, maybe even 2017. But anyway, DHS was required by the legislature to research another methodology, another way to price this service. DHS contracted with a vendor who conducted the research. That's what this vendor does, and wrote a comprehensive report that was actually linked in a communication that DST Fiscal worked with the Healthcare Administration and Provider Services Division to drop into providers enrolled to provide this service into their minutes folders. So all providers enrolled to provide this service should have a link in that memo to the actual study. That actual study is what informed the Minnesota legislature as to what rate methodology to move to. And that resulted in the 2023 legislation, which required DHS to implement the new rate methodology in January of 2026. I cannot necessarily remember, and I apologize for giggling. This is not a funny topic. Recall what opportunities there were to offer feedback or comment to DHS specifically about that 2023 legislation saying do this effective 1/1/26. But I do know that between the division, all the policy areas in the division, and specifically DST fiscal policy, we host regular meetings, gatherings, webinars with our partners, with our county and tribal nation partners, as well as our service provider partners. And upcoming legislation or pre-implementation legislation is discussed in those forums. The changes to family residential rates were discussed in a webinar hosted by the DSD fiscal team, the DWRS webinar in that is a quarterly webinar, and it has been on the agendas. Those webinars are in the DSD training archive. So I couldn't tell you exactly which quarters it was on the agendas, but it is possible to go into the archive and look at those and see where it was brought up before. So that's that question. Um, Let me just keep looking. I see another question. Will the 6790 be eliminated just for family residential? So the current 6790 form for community residential services and family residential services, it's a shared form. The updated one will be just for community residential services. Family residential providers will no longer be required to submit that form. So the establishment of a new service agreement will be will not have a DHS form that is required to be part of it. So I'm seeing another question. I'll move to that. I have heard that the flat rate has no change in rate whether the individual attends a day program or is at the foster home all day. Wouldn't this be a concern of fraudulent billing for services while the individual is out of the home? Doesn't this encourage placing all individuals in day programs, even if not their best interest, since pay is the same for providers? I suppose that's a possibility, that the family residential services provider may encourage the individual to attend some type of program off-site where somebody other than the family residential provider is meeting the person's support needs. But a decision like that should still take place in the same way that it does now, which is that it is based on the person's assessed needs and based on the person's own goals and desires. So a conversation with the person's case manager during annual meetings and checking in during semi-annuals, talking with the person's support team, their guardian if they have one. What are their wishes? What would they like to do? Do they want to try to get a job? You know, there are many things that could impact the person's day-to-day life. The flat rate, because it's not based on staffing, it's a flat rate. So persons who have a regular thing that they're doing outside of the residence that does not require the license holder to provide support to them during that offsite activity, um, the license holder will still be receiving the same rate for that day. Will you get the same rate whether a client is at your home 24 hours versus attending a day program 5 days a week? Yes, it's a daily flat rate. The tier refers to the person's case mix. I see a question in the Q&A that, or in the that SME has sent to me. With staffing ratios no longer being calculated under the flat rate model, will providers be relieved of the requirement to maintain a second caregiver on their license? That is outside of fiscal scope. So I'm not sure if there is a subject matter expert monitoring the Q&A who can respond to that. But we'll keep note of that question. That is a great question. I just cannot speak to that myself. So if it's not answered in the Q&A today to whoever submitted that question, please note that it is one we are taking note of.
Charlotte, I can jump in real quick just to answer a couple questions to give you a little bit of a breather and give you a chance to look at some of the other questions that have been coming through.
Thank you.
Hi everybody, my name is Maggie. I am one of the policy staff on the DSD waiver policy and compliance team. And so in relation to the question Charlotte had just mentioned about the requirement for the second staff, whoever sent that in, I would suggest sending it in via the DSD contact form, just so that we don't lose it and we know who exactly to send that answer back to. The other thing I want to address was there's lots of questions in here about federal approval. Has this been approved by CMS yet? The quick answer is no, it hasn't yet. The long answer is that anytime that there is a change made by the legislature that affects anything about our waiver plans, we have to go through a formal submission process, a waiver amendment process to kind of walk through the process with CMS, let them know what the change is, and they review it for compliance at their level. And so there were lots of changes this year, not necessarily to FRS, but to different services. So we've been working on compiling all of those. And within the next, probably, I want to say around 2 weeks, there will be a notice going out saying that public comment period is open. And so what that does is it'll give you access. You'll be able to look at all of the changes that are being made, and then you'll be able to provide feedback to us on your thoughts about the changes, your things that you like, things that you don't like, things like that. And then after that period is done, it goes to CMS. And as Charla had mentioned a little bit earlier, we are, just because of lots of stuff, a lot of moving pieces, we're submitting the amendments a little bit later than we normally do. So most likely we will not have them approved by January 1st. You never know, it might happen. But as soon as we do get that federal approval, then we do put another announcement out so that you guys know that it has come through. Charlotte, can I hand it back to you?
Yes, thank you, Maggie. Okay, so I am going to jump to another question that we've had. I've seen public bill summaries from the 2025 session, specifically House File 1894 and Senate File 2297, referencing a delay of the new family residential services and life sharing rate methodology to January 1, 2029, or upon federal approval. Can DHS confirm whether that delay has been officially enacted into law, and if so, when providers can expect, excuse me, updated communication or guidance reflecting that change? It was not passed. So that was proposed during the 2025 session that ended this past May with a special session in June. But that proposal did not pass and was not included. So we are still required to implement according to that 2023 legislation. What did pass, excuse me, was the increase to the tiered rates of 25.84%. I see a follow-up question. What are the allowable additional services that can be added for people receiving FRS services? That's a little bit outside of fiscal policy scope. I'm not sure if the question was answered in the Q&A, so I urge the submitter to keep an eye on the Q&A to see. If nothing else, hopefully someone can respond in the Q&A with some guidance on where to look for that information. It is in the CBSM, or the Community Based Services Manual, what is allowable with the various residential services. There is a question in here that I'm not sure I completely understand. I'll read it out loud. If there is not an approval by CMS to the rate increases to FRS, will the rate structure that was approved in 2023 go into effect? So the tiered system will still happen as that has been approved. The rates are what we are waiting for CMS approval on, correct? So I again want to punt this question to the policy team, the waiver policy team that is in front of drafting our waiver amendments, just to see where we are with that. The only change I can say to the FRS service is the rate, how we determine the rate. That's it. So as much as that is spelled out in our waiver plans is what we are needing to ask CMS to approve. I see a response regarding caregivers in an FRS home. Is the license holder required to have a caregiver? And I see the response. AFC providers will still need to have a substitute caregiver identified who meets qualifications of Section 9555.6125, Subpart 4, to provide care during emergencies. And I believe that response was also given in the Q&A as an answer. We saw a question, and I believe a response was placed in the Q&A regarding what is the difference between how or if a provider is classified as a life-sharing or family residential services provider. And there was a link put into the answer to that question in the Q&A to current published guidance on life sharing. Life sharing has parameters on no more than 2 people served, and there is information in the guidance on the billing codes, the current billing codes related to life sharing. So it's currently tied to FRS. Basically, it's the same service code with an additional modifier, with specific billing codes and some life sharing specific requirements. I see another question that I also think was answered in the Q&A. Can family members, such as parents, a guardian, sibling, cousin, grandparents, now be eligible to be an FRS and or life sharing service provider? Not for their relative. So that's still the case. That guidance has not changed, or that rule has not changed. And I'm just quiet waiting to see if other questions or comments come forward. This is a great question that just popped up. How do we know what tier our persons we serve will be? Where do we find that information? That would be something you would obtain from the person's case manager. As mentioned before, the person's case mix is determined through their Min Choices assessment. So once their Min Choices assessment is completed, the assessor has done all their work and closed the assessment. The case mix is identified or generated, and that is available in the Min Choices application that assessors and case managers use to assess the person and to plan services, create a support plan for the person. So the case manager would be able to tell you what the person's case mix is and subsequently what their rate will be. I see a question about what if the provider is not involved in the assessment and finds that the assessment is not an accurate representation of their needs and support provided. That question is a little bit outside, well, not a little bit, it's a lot outside of fiscal's scope. So that is a great question that we would want to bring back to our Min Choices Assessments team, policy team here in DHS and DSD, and ask for some guidance on that. So that could be a great question to also to the submitter who put that in the Q&A to submit on the DSD contact form. I don't want to lean too hard into this. The assessment is an assessment of the individual and their needs and goals. Um, so uh, again, I don't want to overstep my knowledge base here and speak to that, but my thinking would be if, as a result of the person's assessment, you, the service provider, receive the person's case mix and you just don't think it reflects the person's actual current needs, you would bring that concern back to the person's case manager. Um, I, yeah, that's all I can say to that right now. I apologize for being a little bit tongue-tied on that question. It's a little bit outside of fiscal scope, but it is a great question. Definitely a great question.
And Charlotte, one of the questions that came in was the difference between 245A and 245D FRS. That
Mhm.
hasn't been answered yet, correct? I can take that one.
Oh, perfect.
Okay, so family foster care, so family adult foster care is licensed under 245A. But if you are supporting individuals who are on the disability waiver, so CAT, CADDY, DD, brain injury waiver, then you also have to have a 245D license associated. So either you as the family AFC provider or contracting with someone who has that, you need to have that 245D license to be able to bill waiver money, which is then billed under FRS or family residential. So if you just have a family adult foster care license, you would be billing elderly waiver or private pay. So those are the differences. So a family adult foster care is the same for both. It's just a matter of needing the additional 245D license to be able to serve individuals on the disability waiver.
Thank you. Thank you very much. So I see another question. If the service agreement expires before CMS approval, should we be submitting a new 6790C? That is that staffing form that has the inputs that will be used in the calculation to generate a framework rate? Yes. The answer is yes. There was a question saying, has life sharing actually been approved by CMS? The short answer to that, and it's a complex answer, is no. There is a meeting, a webinar that can be located on the DSD upcoming trainings page on Friday of this week. That is a meeting of the Life Sharing Coalition, a semi-formal group of interested parties, service providers, and others interested in life sharing as a formal service option, where that can be discussed in more detail at that time. Right now, DHS does have a service code under which life sharing, so basically family foster care, family residential services, semicolon life sharing, there is a service code for that. Um, as far as a formally defined and described service in our waiver plan with a standalone service code, that does not exist as of yet. So life sharing as it exists right now is still a thing, which is family residential with some um, additional conditions or requirements or elements. And it's the same service code or HCPC as family residential services with an additional modifier to indicate that it's life sharing. That still exists. That exists right now. And I just kind of casually threw in that response that there is a meeting of the Life Sharing Coalition that's taking place on Friday of this week. And so any questions or just wanting to listen in and hear a little bit more about life sharing and where things are with that, please register for that webinar. Same place you registered for this one. And I'm just pausing still to see if new questions or comments come in that I should read aloud. So if you have any, keep them coming. I can just say, kind of in this little silent period, there is, as you may imagine, a lot going on with DHS and in particular in the Disability Services Division right now, a lot. And we had a very interesting um, legislative session this year, and a lot of other influences going on, impacting our workload and the um, speed at which things are changing and evolving in our division. So I appreciate everyone for attending today and your patience in waiting for this webinar to happen. Uh, we really appreciate you, and just want to do our best to continue to work together and support you and um, be in partnership to serve um, our neighbors and friends with disabilities who are seeking waiver services and are just doing our best and working hard to develop new guidance and update forms and update policy pages um, as soon as we can. We want to be accurate and we want to be correct. So we are taking our time. There is a question about when will the official rates be published? We are actually in that process right now. So that rambling thank you that I just gave kind of speaks to that. So between things like what Maggie spoke to earlier, she is a waiver policy expert in the waiver policy team. That's the team that works on disability waiver plans as well as other things. Um, we're in a bit of flux in that space. Um, there are other influences impacting the speed at which we are able to publish guidance. So that's all pending. I will say that the time frame for publication is pretty much the same as usual. Usually new DWRS rate information is published in December. So that's framework rates. Those are published in December. There is like an outline of the legislative changes impacting rates that's published usually by the end of October. Um, but these family residential rates are kind of in a little bit of a hybrid space there. They're not a framework rate anymore. So there is a form called the DHS 3945, the Long-Term Services and Supports Rate document, and that has rates for all services available under disability waivers, under aging, elderly, AC and ECS, and under CFSS. And that's a big form and it's a lot to gather from multiple different areas. And that form is pending publication. It should be published here shortly. And that will have a chart showing the tiers and the rates associated with those tiers, as well as the case mixes that are in each tier. Another question, does this affect respite care? I'm not exactly sure what that question means. So if the requester didn't get a response in the Q&A, please put clarification in the Q&A of your question, and we'll do our best to try to answer today. And if we can't get to it, we will use that question to inform future guidance that we publish. Here's another. If an individual already lives in an FRS and gets reassessed and their case mix comes in lower, which may impact the rate and may put them in a lower rate tier than they were receiving previously, is the FRS provider allowed to terminate services with the individual. So the allowable reasons to issue a service termination would not change. So service terminations are not fiscal policy's area of expertise, so I don't feel educated enough to speak specifically to that. But
I can talk about
Yeah.
the allowable reasons if you want, Charla. This
Okay,
is
so
Ari.
let me pass the mic to my colleague. Thank you.
So when we look at the allowable reasons for service termination, a reduction in rate is not a reason for terminating services. The termination could be because it's necessary for the person's welfare and the license holder cannot meet the person's needs. The safety of the person, others in the program, or staff is endangered, and positive support strategies were attempted and have not achieved and effectively maintained safety. The health of the person, others in the program, or staff would otherwise be endangered. And the license holder has not been paid for services, and it isn't about the reduced rate there, it's about payment. The program or license holder ceases to operate, and the person has been terminated by the lead agency from waiver eligibility. There's another allowance for state operated services, but that doesn't apply to these settings.
Thank you. Thank you so much. So I hope that clarifies that that question about if the rate decreases because the person's case mix changes following reassessment. That alone is not a reason to terminate services with that individual. However, if as a provider, you're unable to meet the person's support needs, sounds like that could be. This is another question, how would the rate change if a resident is in an outside service program 2 times a week? It would not. So, again, it's just the rate methodology changing, and because the rate methodology would not be based on, and I'm making air quotes that you cannot see, staffing, the rate is just the rate. So if you have the person in your home or in your care any amount of time, you're able to submit a claim for that day, any amount of time during the day. So if they're at a day program or, doing something else where someone else is meeting their support needs, 6 hours a day, a few days a week, you still bill the daily rate under the tiers. Will the rates go down? And this is another question. If we add another resident like it would have before? No, because previously there was a shared staffing element. So in the frameworks that are currently in effect, there's a shared staffing element. And if you are licensed to serve 3 people, and your shared staffing would be divided by 3. With rate tiers, the rate is tied to the person's assessed needs, their support needs. So that person's rate is their rate. It is not impacted by other people's rates. So if you have 3 people that you're serving and one person's tier puts them in a $200 per day range and another's puts them in a $225 per day range, and the third person, they're in a $250 per day range, that would be the rate for each of those individuals, regardless. I see a question. Was the increase on the rates included in the memo that was sent to providers? Are the rates listed in that memo reflective of that increase? Yes, they are. And that increase is referring to the legislation that came from this most recent session, the 2025 session, increasing the tiered rates by 25.84%. So this is a process question. This next question, if the min choice the min choices assessor gives the assessment to the county case manager, and then the case manager assigns the tiered rate, is that correct? Sort of. The case manager doesn't assign the rate. The case manager obtains the rate. in the support plan. And the support plan application, so that computerized application in which the support plan is created, grabs that assessment data and pulls that case mix. And then if family residential services is being added to that person's support plan, once the user clicks get rate, the rate will populate based on that person's case mix. So there's no kind of case manager picking a rate out of a hat. It's assigned based on the person's case mix. I see some questions in here related to organizations that assist AFC or foster care licensed providers with life sharing partners. And I'm guessing that speaks to that 245A, 245D relationship, but also the life sharing relationship, which is a little bit different. And does DHS regulate the fees that are charged to AFC providers? Those are excellent questions. And I really appreciate whoever popped them in. I'm hoping that the subject matter expert on life sharing who's with us today can respond to that in the Q&A, but I just want whoever submitted that question to know that that is great and that really helps to inform future guidance that we're able to publish in future, I don't know, policy decisions that may need to be considered. I see a question that says, can you go back to the slide that shows the case mix / rates? We didn't actually have that slide. So I didn't include that in this presentation. We just talked about the fact that the rates will be based on case mix. And in the memo that was sent to FRS providers via their minutes folder, that is in that memo, that listing of the tiers, the case mixes in each tier, and just a kind of general description of the tier, as well as the rate assigned to the tier, is in that memo. So hopefully you've received it. If you are a provider and you're on this webinar and for whatever reason you didn't get the memo or you lost it or something happened, please reach out using the contact form. We can give you that information directly. Oh, and we just want to remind people submitting questions. Make sure when you submit your question in the Q&A that you select all panelists. And that lets every subject matter expert who's participating in this webinar today see your question and easily quickly pick out the one that is in their area of expertise. So you'll get a response much, much faster if you make sure to select all panelists. And I am hearing that there are a lot of questions in the Q&A, which is awesome. And I am grateful to everyone for participating and submitting your thoughts and questions. There is no way that we will be able to get to all of them in the next 7 or 8 minutes. So please, if the questions are urgent or otherwise, please use the DSD contact form to submit the questions. We definitely want to hear from you, and we will do our level best. It may take a little bit due to volume to respond to each and every one, but we will do our level best to do so in a timely manner. So thank you all who have submitted questions. I apologize if you have a question in the Q&A that we haven't gotten to even a little bit in any of the questions that we have been able to read aloud. But we will, we'll keep going for the next few minutes and we will respond as best we can if you're able to submit them through the contact form. If you don't see some other publication come out that speaks to the question that you had. I see one more. Will there be updates to the support plan so that the new tiered rates are populated based off the person's case mix? Yes, there will. Yeah, that functionality actually exists in the current support plan application, in the Min Choices application for elderly waiver, where individuals have a monthly budget cap based on case mix. So that functionality is going to be adapted for use in disability waivers for FRS. Will DHS be communicating with FRS providers directly? That's another question. Well, we did do so via the minutes folders. So the memo that was sent to all FRS enrolled providers via their minutes folders was written by DSD, and we partnered with provider services to get that memo to impacted providers, and plan to actually continue to do so in the future as appropriate, and as when there's targeted information that we want to be able to get to directly to providers. So if you don't frequently check your minutes folders, please start doing so, because we do intend to, and we meaning DSD, we do intend to use that conduit a little bit more than we have in the past to communicate with our provider partners. Are there changes? This is another question. Are there changes to what outside waiver services can be approved to support a client in an FRS setting under the proposed rules? No. So the legislation changing the rate methodology for FRS from framework to a tier or tiered rate doesn't, it's only about the rate. It does not impact any other aspect of the service definition or what's allowable with that service. When will guardians or individuals be informed of the rate changes? That information is being published and disseminated using these same channels that we use for any other rate change or rate update. So guardians and individuals who subscribe to e-lists or read through their support plans will see that change. But otherwise, there's not a new communication mode being planned for individuals of this particular piece of legislation. There's a question, are corporate homes affected by this rate change or just residential? Just family residential services. The legislation is specific to family residential services. There's a question about the billing process. Is the billing process similar? Will we still bill daily on minutes, or will we be able to bill on for multiple days on the same line? That is a little bit outside of my scope. I'm not exactly sure how your billing practices work now, but I don't anticipate that your billing practices would change or would need to change. All that's going to change is the rate that's assigned and how the rate is determined. So it might not even change the rate much, just depending on the person's case mix, but how that rate is determined is what is going to change. I don't believe that any processes outside of that, including how often, in what manner claims are submitted and paid out, is changing at all. But that is outside of my area. So that's something I would definitely go take to provider services and ask them. There's a question here. This is interesting. Will a family foster care provider will the rate a family foster care provider receives for providing respite care in their home also be determined by the rate tiers? So the rate tiers are associated with the service code, the Family Foster Care Service Code. So any service provided using the Family Foster Care or the current life sharing service codes will be subject to the rate tiers once they're implemented. Respite care being provided under a different service code would not. It would be whatever rate methodology is used for that service, that other service, respite care, and that is, I believe, market. And I see a question just asking, can providers ask for a rate exception with this change, or is it just the rate that is decided based on min choices? Yes, an earlier slide states that tiered rates are not eligible for rate exceptions. That is in statute. And it is 2 o'clock. This time has gone very fast. We, as I said before, have a lot of questions that came in that we urge submitters, if you really want your question answered, please do use the DSD contact form to submit it. Just know they come into a central mailbox and they are funneled out based on which policy area the question refers to. So we will do our level best to get to them. We got a high volume of questions. It looks like there were about 300, maybe a little more. So that's wonderful, wonderful participation and a lot of takeaways for us. We thank you for your participation, and please, again, be looking for the recording, sharing it with your interested colleagues, and also look for the presentation itself to be uploaded to the DSD Training Archives webpage within the next day. Thank you for your participation. Bye-bye.